Hi, this is Dr. Melissa Shotell, and today we're going to take a look at some of the doctor control features in ClearPilot. So as you can see, I have a setup back for one of my patients. This is a patient that I currently have in treatment with attachments on her teeth, and she unexpectedly ended up having to have a restoration replaced. So with the new restoration, I want to go ahead and do a refinement to make sure that my aligners are still fitting well. So when I get the setup back, I'm going to begin by playing through it so that I can see all of the tooth movements. Since this is a refinement setup and I had already set our initial goal, this case came back very, very close to where I want it because it was based off of my previous treatment setup. So when I'm looking, the main area that I notice is on this upper right lateral incisor. We can see that there is a bit of an embrasure space here that can be improved with a little bit of distal root tip for that upper right lateral. I could always send this back to the technician with treatment notes. However, I find the faster way to do this is to click on the Doctor Edits in the lower right-hand corner at the end of the toolbar. And then this is going to give me the ability to make the edits myself. So I can come over to our panel on the right-hand side and click Tooth Movements. I can then click and select the tooth, and it will pop up with either arrows where I can direct the tooth movement, or I can utilize the panel on the side where I can use the different settings and I can create additional tooth movement there. So it's your preference if you choose to use the arrows or if you choose to utilize the panel on the side. Sometimes for larger movements, I find it a little bit easier with the arrows, and for smaller movements, I find it easier with the numeric values. And one thing that I want to point out about the tooth movement here is that we can see a green arrow both at the incisal edge and at the gingival edge. You'll see when I'm using the arrow that's towards the incisal edge, we seem to be getting more crown tip. And when I use the arrow towards the gingival surface, we'll see that I'm getting more root tip. So I can create the space, or create the tip that I want to close the space. I can also see where I've created spacing and a collision. And we can make minor movements until this is refined. I'll double click on the tooth to deselect it, and then we can see there quite a difference in that embrasure space. When I'm done with this, I can click off of the Doctor Edits, and I can see the original setup. If I want to go back to check again, I can click on the Doctor Edits and it will show me what I've created. Once I'm pleased with this, I'm going to expand and click Submit Changes. If I do want to give any directions to the technicians, I can type those in the box. So I'm going to ask to please make the changes indicated. To the upper right lateral incisor. I'll click Submit Changes, and I should have my treatment setup back shortly to approve and to order my refinement aligners for my patient. For more tips and tricks on clear aligners, follow me on Facebook and Instagram at Alignerbee.